In our last deep dive, we talked about the Lisinopril cough, that annoying tickle that forces many people to stop their medication. If you were one of those people, your doctor likely switched you to a pill called Losartan. It belongs to a class of drugs called ARBs, or angiotensin II receptor blockers. In 2026, Losartan has become the gentle giant of cardiology. It provides almost all the heart protective benefits of older drugs, but with a much lower side effect tax. However, Losartan has a few hidden tricks up its sleeve, including a strange ability to lower your risk of gout and some fascinating new research into how it might protect your muscles as you age. Today, we are opening the file on Losartan. To understand why Losartan is gentle, we have to look at how it interacts with your blood vessels compared to its cousins. While older drugs like Lisinopril stop your body from making the chemical that shrinks your pipes, Losartan lets your body make the chemical but covers the receptors. Think of it like this. Your body is sending out an emergency alert to your arteries to tighten up. Losartan doesn't stop the alert from being sent. It just puts noise-canceling headphones on your blood vessels so they never hear the command. Because it doesn't interfere with the production of chemicals, it doesn't cause that buildup of bradykinin in the lungs. That means no dry cough. For millions of patients, this change alone is a massive upgrade in their quality of life. But here is the hidden fact about Losartan that most people, and even some doctors, don't realize. In 2026, Losartan is recognized as uric. This is a fancy medical term which means it helps your kidneys flush out uric acid. Most blood pressure medications actually increase uric acid, which can lead to painful gout attacks or kidney stones. Losartan is the rare exception. If you are someone who struggles with high blood pressure and joint pain or gout, Losartan is often the single best choice for your system. It's like getting a 2-for-1 deal on your metabolic health. However, Losartan has a specific requirement for it to work effectively, the salt sensitivity rule. In 2026, we found that Losartan is much more effective in people who have a moderate salt intake. If your diet is extremely high in sodium, Losartan struggles to hear over the noise. On the flip side, just like Lisinopril, it can cause your body to hold on to too much potassium. If you are using Losartan, you must be careful with salt substitutes that use potassium chloride. Too much potassium can lead to heart palpitations, and because Losartan is so gentle, you might not notice the mineral shift until it shows up on a blood test. There is also some groundbreaking 2026 research into Losartan and muscle health. Scientists have discovered that Losartan blocks a protein called TGF-beta. In younger people, this protein helps with healing, but as we age, too much of it can lead to muscle scarring and weakness. Early trials are suggesting that Losartan might actually help seniors maintain their muscle mass and recover faster from injuries. While we still use it primarily for blood pressure, we are beginning to see it as a longevity molecule that protects the structural integrity of the body. So what is the 2026 Losartan protocol? First, the hydration factor. Losartan works best when you are properly hydrated. Because it changes how your kidneys process fluids, being dehydrated can make the drug too concentrated in your system, leading to dizziness when you stand up too fast. Second, the gout connection. If you have a history of foot or joint pain, ask your doctor to monitor your uric acid levels. You might find that Losartan is helping more than just your heart. Third, timing consistency. Losartan has a shorter half-life than some other heart meds, meaning it stays in your system for about 6 to 9 hours, though its effects on the receptors last longer. Taking it at the exact same time every day is crucial to prevent pressure spikes in the early morning hours. Losartan is proof that heart medicine is becoming more refined and more human-friendly. It protects your brain from strokes and your heart from failure, all while leaving your lungs clear and your uric acid in check. It truly is the gentle giant of the medicine cabinet. Stay informed, stay healthy, and I'll see you in the next one.